Hello, my name is Dr. Dewan S. Raja. Today I will discuss about the anatomy of the muscles of the arm. We have muscles of the front of the arm. We have also a muscle at the back of the arm. So we have three muscles at the front of the arm. These are the coracobrachialis. From the coracoid process to the arm, so that is the coracobrachialis muscle. So this is the coracobrachialis. The biceps brachii muscle, two head. One is, this is the head, this is the short head, this is the long head, biceps brachii muscle. And another muscle is the brachialis muscle. So we have three muscles of the front of the arm. This is coracobrachialis. This is the short head of biceps brachii, and this is the long head of biceps brachii, and this is the brachialis muscle. On the posterior aspect of the arm, we have a muscle. There is the triceps brachii muscle. Triceps, it should have three head. This is the long head of triceps brachii. This is the medial head of triceps brachii. This is the lateral head of triceps brachii muscle. Okay, so we will go through the origin, insertion, nerve supply, and action of each of these muscles. Okay, first of all, let's go to the coracobrachialis. From the tip of the coracoid process or apex of the coracoid process, this is the muscle. This is the coracoid process of the scapula. From the tip of the coracoid process to the middle third of the medial surface of the humerus, and this muscle is the coracobrachialis. Very important muscle. This muscle is pierced by the musculocutaneous nerve. This muscle acts as a key to identify the brachial plexus. Okay, nerve supply is from the musculocutaneous nerve. The musculocutaneous nerve actually pierces this muscle, and musculocutaneous nerve also supplies the biceps brachii and brachialis muscle. Its root value of this nerve is the C5, C6, C7. Okay, we got the origin, insertion, nerve supply, action. Action, we always pull the insertion towards the origin, then we'll get the action. So if we pull this part towards the origin, then there will be flexion of the arm. You can say flexure of the shoulder joint here, and it will also adducts the arm. If I pull this part towards this part, then there will be flexion of the arm and adduction of the arm. So this is the tip of the coracoid process, and this is the insertion of the coracobrachialis, this part. Our next muscle at the front of the arm is the biceps brachii, two head, and this is on the anterior aspect. Anterior aspect means the anatomical, this is the anterior aspect of the arm. Short head, again coming out of the tip of the coracoid process. Usually coracobrachialis is medial and the biceps brachii is a bit lateral. Both of them takes origin from the tip of the coracoid process, the short head of biceps brachii and the coracobrachialis. Long head is coming from the supraglenoid tubercle of the scapula. The scapula, this is the glenoid cavity. We have at the above the glenoid cavity, we have the supraglenoid tubercle. From there, this is coming and it is going through the intertubercular sulcus of the humerus, and this is the long head of the biceps brachii. Insertion, the muscle will insert to the radial tuberosity. radial tuberosity here. Okay, one part, and the posterior part of the radial tuberosity usually is separated by a small bursa here. This is the tendon of the biceps brachii going to the radial tuberosity, posterior aspect, and another part of this muscle inserts as bicipital aponeurosis and blended with the deep fascia of the forearm. Action: the biceps brachii is a very strong supinator. It's supinator of the forearm. Okay, for the screwing movement of it, if you put a screw and if you like to open the screw, then we'll have the supination position. It is also a flexor of the elbow joint and also a flexor of the shoulder joint. So when a muscle passes over a joint, it should work on that joint. It is a supinator. It is a flexor of the elbow. It is also a weak flexor of the shoulder joint. And it also, this head, especially long head, it prevents the dislocation of the shoulder joint. Okay, we got that muscle, biceps brachii. This is the coracobrachialis. Okay, this is the coracobrachialis here again, and this is the brachialis muscle. Brachialis muscle does not take origin from the scapula. Brachialis muscle takes origin from the humerus here, from the lower half of the front of the humerus, both anterior, anterolateral, anteromedial aspect, the lower half of the humerus, and it insert to the ulnar tuberosity. Okay, we'll go there till insert to the coronoid groove and the ulnar tuberosity. We'll go there very soon. So brachialis muscle, this is brachialis muscle, okay, and it takes origin from the lower half of the front of the humerus. Lower half, anterior aspect, including anterolateral aspect, anteromedial aspect, and it inserts to the ulnar tuberosity. So radial tuberosity for the biceps brachii, ulnar tuberosity for the brachialis. Plus, it also inserts to the coronoid process of the ulna. So here is the insertion of the brachialis. This is the insertion for brachialis. So it inserts to the ulnar tuberosity here and the coronoid process of the ulna. Action: it flexes the elbow joint. Okay, it has no action, the shoulder joint, because it does not cross the shoulder joint. Nerve supply: musculocutaneous nerve. Root value: C5, C6. Musculocutaneous nerve coming from which plexus? From brachial plexus. From which cord? From lateral cord. Okay, we got that. Then we'll go to the muscles at the back of the arm. That is the triceps brachii muscle. Triceps. It should have three heads: long head, lateral head, medial head. Long head is this, is the long head, from the infraglenoid tubercle of the scapula. Then we'll go to the lateral head. Lateral head is here. This is just an oblique fashion. It takes origin from the posterior aspect of the humerus above the radial groove. This is the radial groove. Then we'll have medial head here. Medial head takes origin from the posterior surface of the humerus below the radial groove. So this is the medial head area of origin. This is the oblique origin of the lateral head. In between them, we have the radial groove. Radial groove contains the radial nerve and the profunda brachii vessels, profunda brachii artery and profunda brachii vein. Okay, we got that. So origin of the long head from the infraglenoid tubercle of the scapula. This is the glenoid cavity, infraglenoid tubercle. So long head of the triceps takes origin from the infraglenoid tubercle. But how about the long head of biceps brachii is from the supraglenoid tubercle. Nerve supply, posterior aspect, this is the location of radial nerve. So radial nerve supplies this muscle, triceps brachii muscle. Action, this is the chief extensor of the elbow joint. It is inserting to here the proximal part of the olecranon process of the ulna and fascia of the forearm. Here is the site of insertion. This is the olecranon process. This is the olecranon process. So if we pull the insertion towards the origin, then we'll get the extension of the elbow joint. Okay, and long head also prevent the dislocation of the shoulder joint. Okay, so this is the dissection of the arm with the transverse section here at this level. At this level means that just below the insertion of the coracobrachialis here. So we are getting muscles. Here, this is the posterior compartment. What is the muscle? The triceps lateral head, triceps long head, and triceps medial head. Okay. This is the anterior aspect. What is the muscle? Biceps brachii, short head is here, and the biceps brachii, long head is here. Deep to them is the brachialis. And what is this? What is their nerve supply? By the musculocutaneous nerve. Remember, median nerve, ulnar nerve has no innervation at the arm. Okay, we got that. And we got, here is the median nerve is here, ulnar nerve is here. Okay, we got that. And this is the radial nerve. Radial nerve also innervates the brachialis. Brachialis is mostly innervated by the musculocutaneous nerve, but radial nerve has also partly contribution to the motor innervation and also sensory innervation of the brachialis. So brachialis has dual nerve supply, double nerve supply. Okay, we got that. Okay, we have some note. Clinical notes. Rupture of the tendon of the long head of the biceps is common, especially in case of weightlifting, in case of old age, okay, or any type of forceful flexion that may cause damage to the tendon of the long head of biceps brachii. It may be ruptured even due to tendinitis, due to any region, okay, or trauma to the tendon. We call it Pope's deformity. The lower part of the biceps brachii becomes swelled up. We call it Pope deformity. This is the deformity of the biceps brachii lower part. It is swelled up. It will be, muscle will be concentrated and the tendon will go up. Okay. Dislocation of the tendon of the long head of the biceps is also common. Okay. And for the neurological examination and part of physical examination, we use a hammer, okay, to assess the biceps reflex and triceps reflex. By means of the examination hammer, we can assess the biceps reflex. We just hit on the biceps, we may hit on the triceps. We will assess the nerve supply of the and also the specific spinal cord lesion. Any problem we can assess by these reflexes. These are deep tendon reflexes. Okay, and that's all about the anatomy of the muscles of the front of the forearm and muscles of the back of the forearm. If you have any question, please feel free to ask me. Please share the information with your friends and please support my channel. Please subscribe me and have a nice day. Bye now.